Well, let me start out by asking, how many of you have experienced a personal loss in your life? Whether it was a family member or a friend, or even a treasured pet. Most of us have, or we wouldn't be walking this planet. It's just part of life. January 19th, 1972. That was a day that changed my life forever. And it changed me as a person. It changed how I looked at life, how I looked at death, and how I looked at dying. And the 3 months following that day also had a huge impact on my life. I was 13 years old. My father had suffered from heart disease for the last 10 years. And on that day, we lost him. And in the 3 months following that, I lost my grandmother, I lost an uncle, and I lost my collie, who I'd had my whole life. And experiencing all of that at such an impressionable age had such a huge impact on me. And I think maybe it's part of the reason why I do what I do and why I'm so passionate about this industry. Well, when we look at our personal feelings towards death, each and every one of you has had your own experiences with death and dying, and it certainly shapes the way you as a professional and you as a person deal with that. Now, when we look at this country and our focus on youth, oftentimes I think in this country we are just in a state of denial. The one thing we can count on, what do they say, is death and taxes, right? But in this country, we have a tendency to want to deny that it's ever going to happen to us or anyone that we love. There's also this food is life connection. We're taught from a very young age. We know from the time we're just tiny that if you don't eat and you don't drink, you're not going to be healthy and you may not live. And then there's the food is love connection. We have such strong cultures and traditions that revolve around food. And we feed people when they don't feel well. We utilize food as part of our loving and our caring. It's such a major part of our culture. When someone's ill, as a caregiver, we have a tendency to beg them, please just take one more bite, just one more bite. And I'm sure that some of you, as well as I, have heard from the loved ones of the people that you're caring for. We can't let mom starve to death. We can't let her dehydrate. That would be so painful. And people have a very strong belief revolving around those items. Well, some of you have had medical training. I know we have kind of a mixed audience here today. But regardless of your training and your role, I assume you're all from long-term care. Is that correct? Anyone who's not? I'm hoping that this presentation this morning will provide you with some education and some things to think about whether you work with the dying patient or not. That hopefully you'll take away something personally, if not professionally.